Hey there, this is Dr. Bob McIntosh with Healthsource Chiropractic, and I'm bringing you another condition of the week. And today's condition of the week is disc bulge or disc herniation, and I want to be able to talk about some of the symptoms first and then what it actually is and tell you more about the anatomy. So when we go through this, a disc bulge is in the low back. Okay, in the anatomy of the low back, you end up having, you have a whole bunch of bones in your low back, five lumbar vertebrae, 12 thoracic vertebrae or your middle back, but we're going to focus on the low back or the disc bulge and herniation. So when you have 23 of these cushions between each of the bones in your spine. And so these cushions end up being made of some tissue that I'll talk about here in a minute that can actually push out and actually push on the nerve and cause a lot of discomfort and a lot of pain for people. So symptoms, when I'm going to go through this sheet here. So we have the symptoms that are the severity and location of the pain can depend on the level. So if it happens upper in the lumbar spine, it can come down to the groin area as cause pain through there, or down through the knee, or down through the ankle, or down into the foot. And you can only have those types of pain, but it really is a disc herniation that's causing the actual pain. So the pain may spread through the buttocks or back of the thigh into the calf in a general area, or else it might be very specific and be that pain. So you need to make sure it's evaluated, and it can be in one leg or both legs. Two legs are more severe than one leg, but it's a warning of what's going on. So some of the big bad signs are going to be numbness, tingling in the toes or in the leg or in the groin, those types of things, or even bowel and bladder changes. Those can be a big deal. So in severe cases like this, the only comfort that can be seen is when a person's laying down, bending their legs up, and it's taking the pressure off of the cushion or that disc that we were talking about, and then also pulling the stretch off of the nerves. So it's very similar to what can happen into the actual neck and the nerves in the neck, but we're being specific to a disc bulge or herniation in the low back today. So again, there's 23 of those discs, and they have a gel-like substance that's on the inside of the disc. The anatomy of it, you can see I can pull this disc out right here and separate the bones. And on the inside of it, of this cushion right here, is a gel type of a fluid. And what can happen on that is the disc itself so the disc is here, this can bulge out and push on the nerve that comes out right here, and it can hurt it. And so what ends up happening then is on this spine model is you can see it plain as day on this red spot right here. So with that bulge or disc herniation affects that nerve, and that's where it comes down into the groin or down into the thigh or knee, and then down into the leg. So that is a bulge disc or a herniation in the low back. So if you know somebody that's having this condition, this is a primary condition that I'd like to be able to treat in our office, because we're extremely good at being able to figure out if we can actually impact it. And if we can't, because there is sometimes that I can't do anything for it and I have to be able to send it out. So, but number one thing is, if you want surgery, go to a surgeon. If you don't want surgery and you want to avoid it, come to us and we'll be able to give you an answer one way or the other. So Dr. Bob McIntosh, Healthsource Chiropractic.